Hello, I'm Dr. Gay Carlson, President of the American Academy of Child and Adolescent Psychiatry, with another of my Screenside chats for our AACAP members. Screenside chats are meant to share timely clinical practice and other information from experts on key topics during this horrific COVID-19 pandemic now confronting us. Reminiscent of President Roosevelt's fireside chats during the Great Depression and World War II, I'm hoping they'll be informative and comfortable and fill a niche not addressed by materials otherwise available. Today, our chats addresses the question of integrating work and life during this new world order that's been, challenge is the word that's been used a lot. Let's face it, it's a drag. In prior weeks, we've talked about back to school considerations, how to decide what's best for our child and what's best for our patients. But today we're going to talk about us. I have Consuelo Cagande, known as ChiChi to her friends. She's an associate professor, senior associate program director and fellowship advisor, and division chief of community care and wellness at Children's Hospital of Philadelphia. At AACAP, she's a member of AACAP's Committee on Women in Child and Adolescent Psychiatry. She can speak from firsthand experience. She's married. She's a mother of a senior college student and a sophomore high school student. To bring up the younger end of the spectrum for managing families, she's collaborated with her Women's Committee colleague, Dr. Elizabeth McGuire, who's a staff psychiatrist at Child and Family Guidance Center in Los Angeles. Elizabeth has contributed, as I said, insights for those with younger children, as she's got two of those, one of whom is a new first grader. So, you make a distinction, ChiChi, between work-life integration versus work-life balance. Why are you doing that? What's the difference?
First, thank you, Dr. Carlson, and thank you for having me. It's an honor to chat with you. When we say work-life balance, it really means a separation of your professional and personal lives. It's a balancing act that tends to force you to one side and not the other, and vice versa. And it, as you know, balancing is very difficult and challenging. And when we say work-life integration, it means a connection between work and life. And this is something that I have learned throughout my life almost since, working. It's not something that you learn to do right away. And it does take time and practice and a lot of support. And we are finding it really more challenging to separate one from the other. Therefore, we need to connect the two and find ways to make it work. For example, just a really small example is attending a wellness session like meditation or yoga at 12 p.m. in the middle of the day of your work day, in the middle of work hours, instead of after hours, so that you are not having to worry to go to the gym after work, but you're doing it within work. Because when you go home, there are other things that you need to do. So it's really a positive approach, focusing on bringing the several aspects of your life, such as work, family, and personal. And it's erasing those boundaries, that line, and striving for overall fulfillment of all life goals, leading to a happier workforce and productivity for us.
I was, when you use the term, I was thinking one of my supervisors when I was a fellow was a senior psychologist, actually a woman. She said, as a working mother, you can't waste a gesture. If somebody rings the doorbell, I grab a dust cloth and do the dusting on my way to the door. I don't know that she actually dusted the furniture. I think it was a metaphor. But I think, is that what you're talking about? Is being able to make things efficient and work together like that?
Yes. I mean, we are, again, trying to make work and life fit and connect together, but not separate it, because we really can't balance a lot of these. And I guess it's almost like, multitasking, but being efficient and not necessarily making it too daunting or stressful for you. It's okay to multitask. I know a lot of us, there are people that say it's not okay to multitask, but I think if you do it in a very structured or way and efficiently, and just have to make it work and find ways. And I would like to say some things, and I think I'll mention later about how to do these things in terms of integrating work and life.
Well, so the question comes up for those of us who are parents. How do you do that? How do you integrate your work, your personal life, and your child's education? That is what's been daunting. And obviously you're going to talk about it from a woman's standpoint, but we have lots of men out there who are faced with similar challenges. How is it different for men?
Yeah, I mean, women have the instinct of being caregivers and may have a hard time giving up the childcare part, but the new norm of working at home is almost nonstop now, and it's as we mentioned or heard mentioned that we're in a marathon, and women are usually the default parent, and adjusting even more during the pandemic. The default parent is the one responsible for the emotional, physical, and logistical needs of the children, and men, in terms of logistics and administrative duties, tend to be the backup parent. I mean, even before COVID-19, 75% of women often worked a double shift between work and home and averaged 20 hours per week more than the male counterparts on childcare and household responsibilities. It's no surprise that today women are feeling like they are working more hours and harder. Despite men's increased participation in household labor in recent years, though, women continue to spend more time on household roles, including childcare, housework, and elder care. But since COVID-19, both partners had to adjust to new schedules. For example, one would have to work evenings, the other work days, and others had to start work on weekends. And there was a huge decrease in mental reserve. And we lost a division of time, the quiet time, that time to just shed work role when you get home. But now not leaving work, if you're working from home. So the pandemic has impacted men as well. And some men are the primary caregivers and have challenges of integrating work and life also. In general, though, women get that calling more. Mom, help me. Mom, what's for dinner? Mom, I need help with my clothes. Mom, Susie, Johnny hit me. Mom, I can't find my shoes. And some men may have also lost their jobs due to the pandemic, and they themselves become the default parent, which can be foreign to them as they've always relied on their counterpart. I'm speaking more about heterosexual couples and not so much about single parent families, LGBTQ families, or other constellation of family, which we could spend some time on. But, every situation is different regardless of gender. Every parent plays a role in their family, and the default parent does apply to same-sex marriages as well. One parent is identified as that default parent, the one that's going to be called on all the time, and thus have the same challenges of integrating work and life. For single parents, again, they're the sole breadwinner. They're automatically the default parent, which make it even more challenging for them, especially with loss of daycare, and they themselves have to work at home. Lastly, there are other economic, family, and community issues and losses that may impact their support networks themselves.
Have you heard of any creative ways people are using to get around these kinds of things? I know I read in the paper a lot that parents are forming pods, that they're coming up with ways of sharing responsibilities amongst colleagues where, each person might take a particular day after school and take care of the kids, or they might chip in and hire a tutor and have somebody like that take care of helping the kids with their online learning. I guess I've been impressed with the fact that some people have been resourceful. Unfortunately, that takes resources. You need money. You need friends. You need a way to be able to develop a pod of people that you can rely on and trust. But I wondered if you'd heard about any of those kinds of options.
Oh, yes, yes. We see it a lot, and my friends as well are trying to arrange that themselves. My colleagues have had to pivot almost, since a lot of schools now are changing to e-learning versus in-person or hybrid. And some people may choose additional help, such as, forming pods within your neighborhood or within the same school. But there are other, ways, such as maybe having a furloughed teacher who's not working, or using nannies, of course, who themselves have been social distancing and otherwise lower risk. And just basically using those as resources. And right, it's very challenging when you can't afford, or you can't you don't have time to use those resources. But I think what I have seen throughout this COVID-19 is a sense of community within neighborhoods, within school communities, within even religious, ethnic communities. They're really reaching out to each other and helping each other. And I think those are good resources to maybe even look at. The sense of community is really, really important in helping integrating life and work, and especially now with school starting. And that's very challenging.
Are you aware of social media options or connections or whatever that people can find each other that way?
I'm not fully aware of national, but I know locally and regional, and I'm sure there are a lot of that they can find within their own region and locals. For instance, there is a Facebook page. I'm in Southern New Jersey, Philadelphia area. There's actually a Facebook page for Southern Jersey mothers and even Southern Jersey physicians that support each other and will post things for recommendations and resources. So I would definitely recommend looking for those in terms of the local and regional area, because I think that's more, again, that sense of community that you can have, and knowing that all of those in your specific community know what's going on and could be more of a resource.
One of the things that was actually crossing my mind as we were talking is we probably haven't missed the time we've wasted commuting.
Yeah.
Maybe that's one of the positives, that some of that time that we used to waste in traffic or things are times that we can use in other more resourceful ways. How do you think the demands for integrating parenthood and professional life has affected academia? Are there special challenges that we have in academic medicine that's different from other kinds of challenges that working parents have?
Yeah, especially for the women in academia, during the first couple of months, women had to stop their research work, and it has been, published out there that the results of decreasing research or even stopping the research and writing has resulted into lower paper submissions. And for some women, it forced to decrease FTEs. And I'm sure this is happening, to men as well. And these really could be possible ramifications to this over the next several years, and I'm afraid, and impact on women in leadership roles, in research, or having access to grant funds. Gender resource disparities, even before the crisis, will make it even more difficult for women faculty to return to full scholarly productivity when this crisis ends. And I'm hopeful, though, that women will return to their research full time again when this ends. But it definitely has greatly impacted, publication, research, and because of having to work at home or tend to family life, especially with those who have young children and have to stay at home and homeschool them or help them with their needs.
I think well, I shouldn't say this, I can only speak about my own institution. I think they've put a moratorium on the academic clock ticking, where you've got a certain number of years before that you have to get a certain amount accomplished in order to get promoted. I think there's been a moratorium on that because it's just I think it's been a problem for all genders to be able to be as productive as we were, whether it's that you don't have time at night to write or you haven't been able to get patients in to do your research. I think about the only positive thing you can say about it is that this is a worldwide pandemic. So it isn't like, oh my God, they're going to get ahead of me in Spain. Spain is just as crippled as we are. And
Right.
So I think that there's a whole moratorium on the world's progress, as a matter of fact. I know when my kids were young, I was able to get my kids to bed by 7:30 at night and work after that. But I wasn't educating them during the day. I was sending them off to school or to their daycare person or whatever. And so, yeah, I did the mommy thing when they got home and so forth, but it was not 24/7, which is the way it is now.
Right. Right.
Have you found anything in your travels or in your talks with the Women's Committee? Things that you can give as advice or tips for other parents, other people like us?
Yeah, I hope so. But I was just thinking of what you said too. It's when we're writing and academia. I myself too was just thinking about my experience with the kids, and then 10 o'clock, 11 o'clock, I'm in on the laptop. So definitely 24/7. So I think, some of the tips that I've heard and read about and, and also discussing with the other women in the committee and especially with Elizabeth, I think first and foremost, I would say explore your own personal and professional priorities, with your significant others, family, and mentors. And plan to reevaluate maybe priorities at regular intervals, when we're trying to integrate work and life. And this could also mean, even your career plan down the road. A few things that also come to mind, and even, during this pandemic, but I think really good tips that we could use even beyond the pandemic or in any day with or without a crisis. First and foremost, self-aware and setting your goals, like I mentioned earlier. What
does that look like?
Mm-hmm.
What does that look like? You get up in the morning and sometimes your goal is just, let's get the cereal poured and, stop them from murdering each other in the next room.
Right. So yeah, I think one of the tips that I wanted to talk about too is also being flexible, and flexibility doesn't mean that it's not structure or things like that. So I think one of the things to set goals for yourself is a schedule every day, and you have to have everyone on board within the family, on the unit, on what the day is going to look like. I think we get too hard on ourselves when we can't integrate, helping with homework and having dinner on the table and work. So we really have to have that self-compassion. We really have to give ourselves a break a little bit. And that can help. That can help our mental well-being. So
you're not eating tonight, guys. I'm feeling compassionate towards myself. You're out of luck.
And whether they're not eating or not, they need to know that you're also dealing with stuff. And maybe I have a college student and a high school student, right? And right now they're at home, and I'm like, I'm leaving. You know where to get the food. Fortunately, they're old enough too to just boil water and make pasta and mac and cheese, right? But take your vitamins.
Mhm.
So yeah, it's really, really challenging. But I think one of the things that I also remind myself too in terms of self-compassion is, being creative in shift and hours. I notice hours that you're most productive. For me, I'm more productive in the morning to mid-afternoon, so thank you for having this in the morning so I can be more productive. But everyone works differently, right? There's no one size fits all, or, I could give you this script, I could give you this tip, but it might not necessarily fit you. So that's why you have to really be more self-aware and explore your own personal needs. And some prefer to work on weekends or nights, but also being flexible with your day schedule. An example would be for me, like my daughter. She does fencing, so I'm bringing her to her fencing training, which is at 6:30 to 8:30. But before that, I leave from work, I go home, spend some time. Hey, let's grab some snack or eat a little bit. Talk to her how your day was. 6:30, 8:30. While she's training, I'm in the car with my laptop working, preparing things. And then once 8:30, then I'm back to her, focusing on her. So it takes that time of being creative with your shifts, your hours, and being flexible. And needless to say, we have a lot of late dinners, and if it's late, it's late. What can you do? With me in my household, there's no traditional dinners at 6, or dinner could be at 4, or dinner could be at 9. And equity at home with chores, children's schooling, care is really important. You have to be explicitly delegate tasks to partner, such as Elizabeth. She gave the example of with her young children. She did one school subject with her kindergarten age son in the mornings when she was free, and the other subject to her husband in the afternoon, because that's the time when she would be working. So it's all about, flexibility, being creative in shift hours, especially during this time. And that, everyone is home most of the time, so we are here together. We are in it together. So it's that in it together campaign that you have to give to, your family, your support system. So those are things that I think about in giving tips and I've read about and talking with women and how they have been trying to integrate work and life. And of course, most importantly, as psychiatrists, we have to take care of our own mental health, and, having to take that time off. Various studies have shown that, taking time off, even just changing your environment and doing something relaxing can improve productivity, and make a hard rule that vacations are true vacations from all things work. And I laugh because I really have to do this better for myself. I am slowly trying to do that, really take a true vacation, but there's always that meeting that falls into it that you can't miss. And I'm like, all right, it's just 1 hour of the vacation. Let me just log on, unfortunately virtual, and then you're done, right?
See, now, and this is where I think we have to be honest about things. I've always said that one of the things that can help me relax is knowing everybody else is taken care of. Okay, so I'm good when you're good, right?
Yeah.
If I take time off and then there's a mess, I get it in the neck. I'm the one that has to clean it up. Twice as much work. So I have come to the conclusion that if there's going to be a vacation, that you structure it the same way you structure other things. You say, okay, I'm going to be away. If you want me between 8 and 10 in the morning, I'm there, and we'll solve all, and you just make it wait. mean, obviously you can't do that all the time, but I also think you have to be realistic. If you've got a
Yeah.
responsible job, the buck stops with you and you're going to pay for it one way or the other. I also think that that's, I guess, the two other things that I have found in terms of the schedule business. I say to my colleagues who are trying to learn how to do research, you need to put research in your appointment book the same way you put in patients.
Mm-hmm.
You put in, you know, journal reading from 4 to 5 on Wednesday afternoons, or data collection 4 to 5 on Wednesday afternoons. You need to put it in there, and it needs to have the same
Priority.
yeah, the same traction as everything, the other things that you do. And I think when you're scheduling stuff at home, it's the same thing, that you can schedule the various things that need to be done. And you schedule, I'm going to go color my nails, or I'm going to take a walk, or I'm going to take a bubble bath, or do whatever it is. And it's scheduled, you know, 4 to 5 bubble bath. I also think that you can't do it obviously for infants, but once you've got kids that are at least 4 or 5, it seems to me that that schedule is a community activity. And I think that having your children participate in how that schedule looks and what they're called upon to do probably works better than just saying you empty the dishwasher and you, I don't know, put the laundry away, or whatever the thing happens to be. It's kind of like, these are the things that need to be done, and you know, let's have some discussion about how it's going to get done.
Yes, exactly. Yeah, again, we're in this together. You know, we're here together. This is how it's going to be in order for us to really get through this pandemic or any crisis. But it could be even without a crisis, because life was already stressed before, and now we have this pandemic and it adds more stress. So I think these are things that, I really appreciate your comments about those and additional, perspectives, because it is important. And making appointments, and we have to really pay attention to our own wellness and well-being. And there's a huge initiative now, and I'm sure in every institution here, especially at CHOP, taking that time off. There are a lot of programs being offered, 30-minute sessions to just share your experiences, 30-minute water coolers. And thank goodness virtual, you can do this. You don't have to walk across campus to go to a room. Now you can just do it in your office or wherever, or step outside and just do it virtually, and do some meditation, mindfulness during work. And I think that's really important. And that's what we're talking about, connecting work and life, and taking care of our own well-being. And when you say, we have to really also role model this to our kids. And we have to also promote this in schools. And I think even before COVID, I've heard schools using meditation or mindfulness, once the kids come in off of recess, they're so revved up and hyper and excited about, being outside, but now they really have to just calm down, and they do that 10-minute, 15-minute relaxation before the next subject. I mean, that's really the right thing to do, and starting that young is really important. And I hope our parents are learning about those things so that they could do it at home as well. So
to wrap up, are there resources that you can recommend for clinicians about work-life integration?
Yeah, so AACAP is already rich in a lot of resources, professionally and for the public and the community. I do want to have a shout out for our own AACAP Women's Committee, that we have a site that is a new webpage actually dedicated to the resources on individual considerations for work-life integration. But there are other resources from other organizations such as American Medical Associations, and I'm sure other specialties. There's institutional and and societal considerations that people should look at in terms of going to their website for more work-life integration. Again, there's a lot of books and blogs that have been done regarding work-life integration, and I think it's important, and I'm glad that this is coming more to the front about this issue.
Well, I appreciate your thoughts, your firsthand thoughts, as well as your experiential thoughts. I don't know whether we'll be in a different position next year, this time, to be able to look back on this time and say, well, I really learned so much, or this helped me grow, or whether it's just, thank God it's over. But I'd like to think that we grow a little bit from each of these experiences, and I try to put that positive blush on things.
Yeah.
So thank you very much for being with us today, and thank you, audience, for tuning in, and we'll see you again in a couple of weeks. Thank you all very much for tuning in. This is Gay Carlson for AACAP's Screenside Chats.